Damon, do you have a whole lot of folks still waiting to get on, or can I get formally started?
Yeah, there's no one in the waiting room right now.
Great, then we'll get started. Good morning, everyone. I know you're out there. I can hear you breathing. No, not really. But I know that everyone's out there, and it's great to have you again for our 18th annual William J. Neff Senior Symposium on the Prevention of Crimes Against Older Adults. And we have a full jam-packed day with lots of kinds of workshops and information to share with you. And so we're going to try to keep on schedule as much as possible. I know it's been a little confusing with the signing on to YouTube initially, and then you go into Blue Jeans, and we'll talk about that in a minute so that everybody can know where they need to go. But I did want to take a minute to welcome you. Once again, we are virtual as we were last year. And so it really is great to see so many people attending on a virtual level. I know that we missed the opportunity for networking, but hopefully next year we'll get back to seeing each other in person. I also wanted to let you know that there are about 300 people attending today that have signed up, which is excellent. And you all are from a great many different disciplines. We have people from long-term care facilities, from the Area Agency on Aging, from social service agencies, home care, from law enforcement, to the district attorney's office, consumer protection, et cetera, et cetera. So there's a great diversity of individuals, and we're really, really appreciative of you taking the time to really learn about elder abuse issues and how we can better work together to address this issue. So I also want to take a minute to welcome Denise Service. Denise is the granddaughter of Mr. Neff. I think most of you, or many of you, are aware that we named this conference the Neff Symposium in honor of William Neff and in his memory, as he was a victim of murder in a nursing facility and really raised awareness in our county about 20 years ago how prevalent this was, and that we really needed to take some more specific efforts to try to address elder abuse. And so it must be very bittersweet for you, Denise, and any of your other family members who have joined to have this continuation, but we are honored that you allow us to provide this conference in honor of your grandfather and in his memory. So thank you very much. I have a couple of housekeeping chores. Holly Tuttle is the person that has been coordinating this. And I asked her, if it's housekeeping, does that mean you're all coming over to clean my house? But apparently no. So that was a big disappointment to me. So, but I do have some apparently other housekeeping that has to do with the conference. And so I'm going to go through those things now. So please note that all of the breakout sessions will be viewed on Blue Jeans today, which you will need to download via the event email that was provided in the links to today's symposium. There's no cost involved with downloading that. And during our morning break, following our keynote speaker, you will have an opportunity to do this if you haven't already done so. Each breakout session has a max allowance of 100 people. So if you find you're not able to join a particular session, please choose one of the other workshops. All of the sessions, however, are going to be recorded and made available on the Bucks County Community College YouTube page playlist within a week or so. So if there was a workshop you wanted to get into and really wanted the information, in a week or so you can go and listen to that and get the information. We do ask that attendees keep themselves muted during the symposium sessions and your video kept off. We want to give a special thank you and shout out to our sponsors who make it possible for us to offer this symposium free of charge. And just so you know, in the 18 years, we've never charged, as far as I know, for the symposium. So it's really excellent and great that we have these various sponsors. In particular, we'd like to thank Independence Blue Cross, the Pennsylvania Link to Independent Living, AARP, Rothkopf Law Group, and Life St. Mary's for their very generous sponsorship. I would also like to encourage you during lunch and your breaks in the schedule to please visit the sponsor page, where each has provided a short video of their services. And again, that would have been in the email link of all the different workshops, the link to that video section. Also on the event email, you will find the evaluation form to complete at the end of the conference. This is necessary for you to receive continuing education credits for today's conference. It also provides us with valuable feedback and helps us to measure whether we've met our goals and expectations to improve the 2022 conference that's coming up. And we really do scrutinize those evaluations, look to see what your topics that you might find of interest. And if you have any suggestions on the evaluation of specific speakers, even for yourself, please put that in your evaluation so that we can contact those individuals, as we're always looking for interesting topics and speakers who are willing to help us out. We are going to try to follow the schedule today as closely as possible and keep to it. And certificates will be emailed out after the conference using the email address you provided at the time of registration. I also want to give a special note of appreciation to Holly Tuttle for all her work in pulling this together. Holly is retiring at the end of this month. She has been an employee for the Bucks County Area Agency on Aging for 22.5 years. And so we appreciate, Holly, all the work that you've done in this symposium and for all your efforts to help seniors in the county. It's been really great. So thank you so very much. And I also want to give a shout out to the rest of the Crimes Against Older Adults Task Force members who are helping us out throughout the day. I particularly want to thank the Bucks County Community College because of your sponsorship through these years and allowing us to, first of all, use your facility when we're in person, but especially helping us during this time of doing virtual conferences. So being able to help us to set this all up and taking that over for us, we really appreciate that. So I'd like to introduce for you now Commissioner Diane Ellis Marseglia. She is the chair of our Bucks County Commissioners. We also have the great advantage that Diane is also herself a licensed social worker. And so she gets it. She understands and knows what it is that those of us that work in the human services, law enforcement, et cetera, area. And so Diane, thank you. And thank you to the other commissioners for your support of this conference throughout the years.
Well, thank you. And we all thank you for having this and welcome everyone. It is great to see so many people are attending the Neff conference to show so much respect and understanding of our seniors, but also the Neff family. 18 years is a very substantial time. And I hope that the pain that the Neff family experienced is felt 1,000 times over for the good they have given to our community in this symposium every year. As a commissioner in Bucks County, one of the counties with the highest populations of seniors, I am particularly grateful for this seminar because so many people get to learn a little bit more and can protect our seniors even more. I have become acutely aware of the senior years recently. I turned 60 this year. So I decided it was time to, minimize, simplify my life, go through addicts drawers. I didn't want to leave all of that stuff for Katie. So I really have been in touch with my mortality the past 9 months. But I also lost my mother. Many of you know she had Alzheimer's and was in Neshaminy Manor since 2012, and she died in June. So at that time, I really have been spending time reflecting on senior years. And I was even thinking about my father, who only struggled for a few weeks, but still had rehab care and still had hospice care. And what occurred to me was just how fragile and vulnerable they are in those years and how we don't think about it that much in our younger years. But as I approach them, it's important to me. I think about how many people interacted with my parents, aides, doctors, nurses, lawyers, bankers over those years. And most of the time I wasn't with my parents. So how lucky I was to have good caregivers, how lucky I was that my mother got to be at Neshaminy Manor where I knew I didn't have to worry. How lucky I was that my father thought of all kinds of things before he passed so that his passing was easy for me and he had everything taken care of. But for so many people, it's just one caretaker can make all the difference, or one set of eyes that doesn't keep an eye on things. And that can change and make those last years so painful instead of the welcoming, calming years that they should be. So that's why this is so important, because everybody who's at this conference today, you are those advocates. You are those extra eyes for the sons and daughters and husbands and wives who can't be there all the time. You're the ones that keep everybody safe. So I am really thankful that you're here. We are lucky to have so many caring people in this community. I had an old quote from Vincent van Gogh that I was thinking of, especially for those of you who work for seniors. He had said that a profession is not what gives you your paycheck. A profession is something that you think you were put on earth to do, that you have such passion and intensity for it that it almost feels like it's a spiritual experience. I know when I watched people work with my parents, it was a spiritual experience for them, and I'm glad to be a part of this today. So thank you.
Thank you, Commissioner. Appreciate that very much, your words. I'd also now like to introduce our Bucks County District Attorney, Matthew Weintraub. Matt has been very supportive, again, of our task force, and his staff have been an integral part of what we do in order to help address elder abuse. And so, Matt, thank you for taking a minute to join us and welcome us.
Thank you, Kathy. Hi, Diane. Hello, everybody. Boy, this COVID has really been a challenge for everybody, but no segment of the population more so than for seniors. I know that it has been very isolating. The challenges have increased as opposed to decreased, meaning that because of the isolation, because of the lack of easily accessible services, that some seniors, probably many of you, have really felt the brunt of what COVID's challenges have brought to us. One of the things that I'm pleased to report, and this is always with the support of the professionals on this call, is that we were able to bring a lot of services to the seniors. We had what I like to call our traveling roadshow. We brought our virtual connections to many seniors. In fact, it culminated with the county traveling roadshow where we did live Zooms with Bristol and Bensalem senior centers, and we're actually able to take some questions. That was the highlight, I would say, but that was made possible through the efforts of Kathy Bennett, who's on this call. Holly Tuttle sometimes participated, Mike from Consumer Protection, Mike Bannon, Brandon Corballis from Senior Law Center, our very own Kate Kohler, who is a member of this coalition. And the point that I want to make is that whether you knew it or not, and if you didn't know it, we weren't doing a very good job. But we want you to know we have been here for you throughout all of these crises, and we will continue to be here for you. I echo Kathy's sentiments that we are here as a resource, and most of what we have to offer is absolutely free. So this training, I think, is just a great opportunity for us to reinforce and re-educate ourselves and bring us back as we get more into real life connections with people. Let's reestablish and rebuild those bridges, because they are more important now than ever, that our seniors have survived. And sadly, we've lost a few of them. I know Diane said she lost her mom and her dad even recently as well. My dad's still going. He just turned 80. I'm very blessed in that regard. And Diane knows he can be a real, put it this way, he takes advantage of all of the services that I've just spoken about. Mike Bannon is like his fourth son. But I would just like to end by saying that the services that most of us provide are absolutely free. Nova is also included there. And we want you to connect to us. We want you to reach out. And I imagine that a lot of those ways to connect will be presented throughout this forum today. I'm very happy to be 100% supporter of this symposium. It's a tragedy that William Neff had to die in the way that he did, but it has not been in vain, because this was born out of that terrible tragedy. And this is something that will continue in perpetuity. So I hope you all have a great conference. Thank you for including me.
Thank you, Matt. Again, appreciate your words as well as your ongoing support. It's very much helpful. So we're supposed to have also a note of welcome from Dr. Felicia Ganther. She is the new president of the Bucks County Community College. She had a scheduling change at the last moment, and we do have a video of her, but we're having a little difficulty getting that loaded up. So we will get that to you at some point, her welcome. But I also do want to, again, thank the community college for all their support and assistance, especially through our virtual time. We're running a little bit ahead of schedule, but I hope it's all right if I can go ahead and introduce the Pennsylvania Department on Aging Secretary of Aging, who is Robert Torres. Robert was appointed by the governor, Tom Wolf, to serve as Secretary of Aging on January 5th, 2019, after serving as the acting secretary since October 11th, 2017. As secretary, Mr. Torres is responsible for the administration of aging programs and services in the Commonwealth and is committed to ensuring that the department is being responsive to older adults, a population that is growing significantly and becoming more diverse. He believes that strategic partnerships and collaborations will be essential to help meet the demand for services for older adults over 60 years of age, a demographic that currently makes up 25% of the Commonwealth's population and is expected to increase to 30% over the next 10 years. And Diane, I'm right there with you. I'm over 60 myself, so we're in that group, girlfriend. Mr. Torres is also concerned with the level of fraud, abuse, exploitation, and neglect impacting older adults and has made that a priority to address. He is emphasizing the effective use of data and data-driven management to help guide priorities and the effective use of resources. Mr. Torres is an attorney who holds a Bachelor's of Business Administration degree from Pace University and a law degree from Widener University School of Law. I have, since Mr. Torres has taken over as Secretary of Aging, I have just been so impressed with his willingness to collaborate with us, those of us who are in the Area Agency on Aging field, how much he really is responding to enhancing the diversity understanding of seniors that are seeking our services and how we can improve our services so that we are better positioned to help more and more seniors. And I am so grateful, Mr. Torres, that you're here today and that you're willing to speak to us. It really is a great honor to have you here. And thank you so much, Mr. Torres.
Thank you, Kathy, for the kind introduction. Can you hear me okay?
Yes, I can hear you.
Okay, I'm always paranoid when we're doing these virtual forums, but thank you for the kind introduction and for the invitation to serve as your keynote. I too am part of the over 60 crowd. When I hit my 60th birthday, my son said, "Dad, now you're really qualified to be Secretary of Aging." But it's a pleasure to be here for your 18th symposium. And good morning, everyone. Before I begin, let me also recognize and thank President Dr. Felicia Ganther and the Bucks County Community College for its support as virtual hosts for this symposium. I understand that they've been gracious supporters and hosts of this symposium from its very beginning. Also like to thank Kathy and her team at the Bucks County Area Agency on Aging for putting this symposium together, along with the Bucks County Commission Chair, Diane Ellis Marseglia, and the County Commissioner's Office, District Attorney Matt Weintraub and the DA's office, and the Bucks County Crimes Against Older Adults Task Force, and the multidisciplinary team that works to raise awareness of and prevent crimes against older adults. On behalf of the Pennsylvania Department of Aging, I thank you for all that you do to protect and serve older adults. The Department of Aging oversees much of the work that's administered by the network of 52 area agencies on aging across Pennsylvania. These agencies do important work and are engaged in their local communities in many different ways. But for me, and I'm sure for many of you, some of the most important work they do is protecting vulnerable and at-risk older adults from abuse, neglect, exploitation, and abandonment. We are extremely grateful for the work that they do every day, serving older adults in their local communities. Our area agencies on aging receive information about older adults who may be victims of abuse when individuals in the community, providers, family members, and others suspect abuse is occurring. The allegations are typically submitted via phone and then investigated by the agency within the local area of the older adult. In state fiscal year 2020-2021, there were 39,762 reports, so almost 40,000 reports of need for protective services for older adults in Pennsylvania. While not all of the reports are investigated because sometimes the issues fall outside of the realm of protective services, our agencies did investigate 88% of the reports, or 34,865 cases. And of those investigated, 37%, or just over 13,000, were substantiated cases of abuse. These numbers may seem astonishing on their own. However, what stands out even more is that they have been growing rapidly over the past several years. Between reporting years fiscal year 2014 and 15 and 2019, 2020, the numbers that I just shared with you increased 80% during that 5-year period alone. Part of it may be attributed to an increased awareness of protective services, leading to increased reporting of the problem. But nevertheless, it is a problem on the rise. And that is why this symposium, named for Mr. William J. Neff Sr., a tragic victim of elder abuse over 20 years ago, is even more important now to help bring together many people of different disciplines who truly care about preventing elder abuse, about protecting those at risk, and supporting the well-being of vulnerable older adults. I'd like to take a little time to talk about some of our department's protective services priorities, the work we've recently completed with our multidisciplinary financial exploitation task force and its recommendation, and then share a bit about ways we will be leveraging technology to increase our efficiency and improve consumer access to services. We are doing this in an effort to improve data collection, timeliness, responsiveness, and ultimately the quality of service we can deliver, not only working within the AAA network, but also working with many of our external partners and stakeholders, which many of you here this morning represent. First, it is important that I share with you our legislative priority of updating the Older Adults Protective Services Act, or OPSA, as it is referred to. OPSA has not been updated in decades, which is amazing when you consider the changing landscape of elder abuse cases. The proposed updates we want to see in OPSA would strengthen background checks for employees in long-term care settings, identify individuals who should never have an opportunity to work as a caregiver to older adults, expand the list of mandatory reporters of abuse, and bolster the financial exploitation reporting process and training for financial institutions. I certainly welcome your support and encourage all of you to help us finally get this legislation to the finish line when it is brought up for action by the General Assembly. In 2020, the department released the findings of a financial exploitation study that it conducted on 455 substantiated cases of financial exploitation across 14 counties that had the most cases. Of the 455 cases, 315 of the victims experienced a financial loss. On average, that loss was nearly $40,000, and 65% of the perpetrators were family members. Sadly, the most frequent method of exploitation was unauthorized withdrawals from bank accounts. Based on the reported financial exploitation cases alone, Pennsylvania older adults lost a collective $58 million in fiscal year 17-18 alone. And it is important to note that we know financial exploitation is underreported, so these losses are likely much, much higher. As a result of the study and its recommendation, a multidisciplinary financial exploitation task force was convened and engaged in a series of meetings throughout the first half of 2021. The task force included professionals from more than a dozen state government agencies, credit union and bankers associations, district attorneys and their association, chiefs of police, the Pennsylvania Medical Society, the Alzheimer's Association, the Pennsylvania Psychological Association, University of Pennsylvania, Temple University, Pennsylvania Bar Association, Elder Law Section, Senior Law Center, and others. The task force engaged in discussions on what financial exploitation is, heard from family members of older adults who were victims of financial exploitation, discussed some of the barriers that could arise in reporting such incidents, examined cases and identified ways that financial exploitation could have been prevented, and submitted 15 recommendations on how to prevent and more effectively respond to financial exploitation. The 15 recommendations cover 4 categories: education, training, operations and procedure, and legislative action. Regarding education, the task force wants to increase awareness of financial exploitation and provide education on the early detection of Alzheimer's disease and other dementias and how it relates to financial exploitation. And we also want to strengthen the education for professionals who work with older adults. Regarding training, The recommendations included strengthening training for adult protective service workers and long-term care ombudsmen, developing a program to assist financial services providers and their employees on how to report financial exploitation, creating a feedback loop between law enforcement and the long-term care facility staff to improve their ability to identify evidence of financial exploitation or to learn from missed possible opportunities. With regard to operation and procedures, the recommendations included designing an online reporting portal that will provide a simple, easy to understand form to use in reporting suspected cases of financial exploitation, developing an online investigators tool to provide law enforcement with resources to conduct a financial exploitation investigation and assist them while preparing a case for prosecution, cultivating relationship between the 52 area agencies on aging and financial institutions so they could support each other on suspected cases of exploitation, addressing issues that may occur when dealing with multiple powers of attorney, finding ways to prevent perpetrators from using life insurance policies or annuities, identifying potential financial exploitation at the county assistance office level, and we've already provided some training in that regard. Increasing and strengthening elder abuse task forces across the Commonwealth, similar to what you've been doing in Bucks County. And then the legislative recommendation was what I referenced earlier related to Opsa, finally getting that over the finish line. Since we issued these recommendations, there have been small work groups that have been working to implement the recommendations, and I can tell you that there is progress being made, and we plan to reconvene later this fall to check on where we're at and to see what support may be needed to make sure that the recommendations do get implemented. With regard to leveraging technology, we are actively working to procure a new application that will help improve our response to cases of financial exploitation by establishing secure, ongoing communication and collaboration between financial institutions and the area agencies on aging. This new application is currently live in 3 states, San Francisco County and the US Postal Inspector, as well as 20 financial institutions. It is anticipated that ultimately this application that we're looking to procure will be standard in all 50 states with all major financial institutions. We then plan to integrate this application with our case management system, which we are also planning to upgrade to a new protective service module, which will also help further improve efficiency and our effectiveness at responding to financial exploitation cases. The new system will enable secure messaging between financial institutions and area agencies on aging, exchange of consents and transaction information needed as part of investigations, and notification when items need attention from either the financial institution or the agency. This one improvement alone will help to streamline the process of investigating these cases, since our study revealed that more than half of them involve bank transactions. We're also working, as I mentioned, to transition to a new protective services case management system that will improve data collection, increase accuracy, and improve analytics to better monitor and manage our work. We will also be adding an online interface to allow the public to enter information that will create a protective services report of need online. Currently, the only formal mechanism that we have to make this report is by phone using our elder abuse hotline or calling a local area agency on aging. Of course, the network also received these reports in the form of letters and emails, but there has never been a formal mechanism in Pennsylvania for individuals to submit these reports online, allowing them to complete the necessary fields in their own words. And we are looking forward to deploying this new capability. Since I started this position, I have promoted increased partnerships and collaboration and better use of data to help us in our work. As part of our overall goals, we are committed to improving the way we serve our clients through better alignment and coordination of health and social services. Over the past several years, AAAs have joined health information exchanges, which some of you may be familiar with. Health information exchanges allow for the safe, secure exchange of health information between healthcare providers who are members of the exchange. In my prior state positions, I promoted the adoption of electronic medical records and the exchange of health information. We are now seeing the evolution of this effort with social service organizations becoming part of these exchanges. Health information exchange can assist in cases of protective services by helping agencies locate older adults. The health information exchange can reveal if there's been an ER visit or hospital admission that is preventing a home visit. The exchange can provide patterns of admissions or emergency room visits that can be noted by an agency. An agency can obtain comprehensive medical history and records, including diagnosis and medical information that can be reviewed as part of an investigation. And a health information exchange allows for better care planning, as it also gives clinical providers care plan information they need to create a thorough discharge plan and recommendations for home and community-based services. I believe that collaboration with and education of partners who care about the well-being of older adults is critically important. We have been working with universities as well as health systems to provide training on protective services to nursing students, providers, educators, geriatricians, and long-term care facilities to help ensure that the Opsa law and mandatory reporting requirements are understood, and that more people are aware of the heartbreaking problem of elder abuse and know what they can do to report it. It is my hope that all of you will not only take away new knowledge from the symposium today, but will apply that information in your work and share it with others so that we can continue to raise more awareness and have a greater impact on the advocacy for and the protection of older Pennsylvanians so that they are embraced and empowered to live and age with dignity and respect. I thank you for inviting me once again for being here, and I hope you have a great symposium.
Thank you so much, Secretary Torres. We really do appreciate your time and your words of wisdom. I just want you to know that this is sitting next to me. I did not just print this out. I want you to know this is sitting next to me. This is the Financial Exploitation of Elder Adults Task Force Report. And if those of you that are more interested, you can go on the Pennsylvania Department on Aging's website and get more information about what Secretary Torres was talking about and the recommendations, which I can also validate. There are things that are definitely in the works that are happening, which is very exciting to hear. And we really appreciate that an effort is being made on this behalf. So thank you, Secretary Torres. Again, we really do appreciate you being here.
Thank you, Kathy. It's my pleasure.
Sure. So we do have, before our next keynote speaker, we do have the video from Dr. Ganther. Dr. Ganther is the new president for the Bucks County Community College. And so I will ask the community college to start that video. Thank you.
Good day. My name is Felicia Ganther, and I serve as the new president here at Bucks County Community College. I am so excited and elated that Bucks County Community College is once again your host for this year's Elder Abuse Symposium. At this time, I'd like to honor the social workers, nurses, nursing home administrators, law enforcement officials, and others who have dedicated their entire lives to ensuring that our most vulnerable populations are protected, supported, and served. We are grateful to the county for providing the resources which provides us a source for continuing education that increases awareness and facilitates communication on these vital issues. I am positive that this day is going to be absolutely fruitful for all of you who are in attendance, and we look forward to hosting you on campus very soon. Please enjoy the day, and thank you for attending this very important program.
That's great. I can't wait to meet her. So thank you so much, Community College, and thank you to Dr. Ganther for doing that video for us. We really do greatly appreciate it and hope to meet you in person soon. So now I'd like to introduce our second keynote speaker, and Lori. We haven't had a chance to talk, so I apologize, but I'm going to, if I say your last name wrong, you can please correct me. I want to introduce Lori Smetanka.
Smetanka.
But I knew that's what it was. Yeah, okay, we'll go with that. So thank you for being here. Let me just tell you a little bit about Lori. Lori is the Executive Director of the National Consumer Voice for Quality Long-Term Care, the leading national nonprofit advocacy organization representing consumers receiving long-term care and services in nursing home, assisted living facilities, and home and community-based services. As Executive Director, Lori oversees and contributes to the organization's policy, advocacy, and program activities, leads the organization's fundraising efforts, establishes strategic partnerships with organizations and federal agencies, working on issues related to the provision of long-term services and supports, and establishes the strategic direction of the organization. As a consumer representative, Lori has testified before Congress and served on federal task forces, technical expert panels, and working groups on long-term care issues. Lori has a BA from Indiana University of Pennsylvania and a JD from the University of Dayton School of Law. Lori is here to talk about engaging and empowering consumers to prevent abuse and neglect. And we are so thrilled to have you to bring this topic to us, Lori. So thank you for your time and your words of wisdom.
Well, thank you so much, Kathy. I'm delighted to be with all of you today. We had been looking forward to coming together in person, and unfortunately that was not meant to be again this year. So would hope to be able to do that again at some point in the future, but I am delighted to be with all of you today. So thank you for the invitation. As Kathy mentioned, I'm the Executive Director of the National Consumer Voice for Quality Long-Term Care. And if you're not familiar with our organization, we are a national nonprofit advocacy organization that works with and on behalf of residents of long-term care facilities. We do our work by advocating for policies that support quality care and quality of life and protection of rights for individuals. We empower and educate consumers with information about their rights, about how to achieve quality care, quality of life, and to get help if they're having issues or problems with their long-term care facility. We train and support advocates, including long-term care ombudsmen through operation of the National Long-Term Care Ombudsman Resource Center. And we promote the critical role of staff and best practices in the provision of care. We know that staff really are the key to ensuring that good care, quality of life, and protection of rights occurs in long-term care facilities. So that is a #1 issue that we work towards. I want to start by saying it's Residents' Rights Month, so it was really fitting. I think that I was invited to speak with you all today, particularly on this topic. Our organization for decades has designated October as Residents' Rights Month, and we find that it's by doing that, it's an opportunity to focus on and refresh our knowledge of and understanding of the rights guaranteed to residents of long-term care facilities, both in state and federal rules. When developing the theme for Residents' Rights Month this year, which is Reclaiming My Rights, My Home, and My Life, we thought it was important to acknowledge the impact of this past year and a half on residents and highlight the need for residents' rights to be recognized, recovered, and reasserted. And so we landed on this theme. When we develop the theme, we don't do it in a vacuum. We talk to residents and family members. We talk to activities professionals, ombudsmen, and others who are engaged, and they help us kind of focus in on what they think would be most appropriate for the year. But we thought that this theme was fitting because since the COVID-19 crisis began, it's felt in so many ways like the world is turned upside down and every aspect of our life has been disrupted. But at the same time, we needed to recognize that so many things had not changed, including the rights to which residents were entitled and are entitled to by federal and state law. So while there are many important rights that residents are entitled to, implementing the rights and incorporating into how to make them a reality in daily practice works not only towards enhancing the engagement of residents and families, which is something we'll be talking about, but also I think to preventing abuse and neglect. I think that if we really focus on engaging families, focusing on quality care, focusing on individualized care, we can prevent a lot of the abuse and neglect that occurs. So I'd like to start off by focusing on some of the specific rights to which residents are entitled. One of the most important and overarching statements in federal law is that each resident has the right to receive care and services to attain or maintain their highest practicable physical, mental, and psychosocial well-being. So what does this mean? It means that the nursing home must provide the care, treatment, and services that are necessary for each resident to reach or maintain their highest level of functioning. They should not decline unless it's avoidable due to a medical condition. So for example, if a resident was continent upon being admitted to the facility or could walk on their own, they should be able to maintain that ability unless a decline was avoidable because of a medical condition. Alternately, if they were incontinent or unable to walk upon admission to a facility, the nursing home should assess them and look at whether a continence program or a therapy could help them regain those skills. The goal is to focus on providing individualized, person-centered care for each individual living in the long-term care facility. One way to ensure residents are receiving their highest level of care is through the care planning process. And as you know, a care plan is a strategy for how the staff is going to help ensure that residents' needs are being met. A multidisciplinary team should be part of the development of the care plan. Nursing assistants, doctors, nurses, therapists, dietitians, and activity staff all have a role in helping to develop a care plan for a resident. Residents can use these meetings to discuss their goals, their interests, their preferences, and their concerns. And they absolutely should be participating in the development of that plan. They have the right to participate in the development of that plan and the implementation of a person-centered plan that focuses on their individual needs. They can also include family members in the development of that plan. As you know, family members know residents better than anyone, and they can really be helpful in developing a plan that would work for the individual. The residents have the right to make decisions about their care, both now and in the future. And they have the right to request care planning meetings if they feel that they need them, if something's not working as part of the care plan or needs some adjustment. It should be a living, breathing document, not something that's just developed and put on a shelf for a quarter or for a year or whenever it needs a new evaluation. In practice, the care plan means that the residents have the right to make choices about their care, their services, their daily schedule, and their life in the facility. This includes the meals that they eat, the activities that they participate in, therapies that are scheduled for them, and their personal schedule, in addition to making choices about their medical care, the nursing care that they receive, and the emotional needs and how that they are met. On the medical side, they have the right to receive adequate and appropriate care, to be informed of all changes in their medical condition, and to refuse medication and treatment. And care plans are to be individualized. They're not one size fits all. And if something in how a person is receiving care is not working, that care plan should be reviewed and updated as necessary. Additionally, we know that residents have the right to be free from abuse, neglect, and exploitation and misappropriation of property. That's something that I know you'll all be talking about quite a bit over the day's events. And facilities have a responsibility for taking specific steps to prohibit and prevent abuse and neglect from occurring, such as ensuring that all staff are screened and trained with respect to how to provide good care, about how to identify abuse and neglect, about how to report abuse and neglect. And they need to be held accountable for doing all of those things. Also, the facility is required to report any suspected abuse, that makes sure that it's appropriately reported and that it's appropriately investigated internally, while also investigation should happen by outside sources. The same is true with residents' property. The facility has a duty to exercise reasonable care to protect a resident's property from loss or theft. It's not sufficient to say that there's nothing we can do if your property is being mismanaged or has been stolen. So it's really important that the facility have policies and procedures in place for addressing abuse and neglect in long-term care facilities, for addressing how they're going to manage ensuring that residents' property is protected, that their staff are trained, and putting into place their processes for ensuring proper reporting and investigation of abuse or neglect should it being occurred. Freedom from abuse and neglect encompasses also the freedom from physical and chemical restraints. And while the use of physical restraints is very low in the country right now, and it is important, I'm really going to address my remarks on chemical restraints today. A chemical restraint, as you know, is a drug, usually an antipsychotic or psychotropic drug used when there's no corresponding diagnosis. So it's off-label, and it's not to treat a medical condition, but rather for the purpose of discipline or controlling a resident's behavior, or for the convenience of staff who may be frustrated by a resident's actions or behavior. I'm sure many of you are aware that there have been many efforts over the past decade or more, including a national campaign that was sponsored by the Centers for Medicare and Medicaid Services, the National Partnership to Improve Dementia Care, to reduce the use of antipsychotic drugs with residents, particularly those with dementia. There had been what seemed to be some progress in reducing the use of these drugs, but recent data and information has been showing some troubling trends, and that's why I'm really raising it today and focusing on it a little bit. During the pandemic, we know that there's been an increase in the use of antipsychotic drugs being prescribed. That's not been surprising. It's something we were really worried about from the start of the pandemic. It's not been surprising because facilities have been significantly short-staffed and families weren't able to come inside to help care for their loved ones or monitor their treatment. We also know that in addition to prescribing the drugs off-label, an analysis of Medicare data recently found that there's been a 70% increase in the number of residents that are being diagnosed with schizophrenia. 1 in 9 nursing home residents have received this diagnosis versus 1 in 150 in the general population. And Black residents had a higher rate of diagnosis than other residents in the facility. Why should we be so troubled by this? Well, first of all, schizophrenia is a diagnosis or a condition that's usually diagnosed in your late teens, 20s, or 30s. You don't develop schizophrenia when you're 85. That said, if a resident does have schizophrenia, it makes sense for them to be prescribed certain drugs or antipsychotics. It's helpful for them and it's part of their treatment plan. But the Office of Inspector General has found that nearly 1/3 of residents who were reported to have schizophrenia did not have any corresponding service claims for that diagnosis. Schizophrenia is one of 3 diagnoses. Tourette's and Huntington's disease are the other 2, where the use of antipsychotic drugs is not counted towards a facility's usage rate and publicly reported by the federal government as part of quality measures. And the use of these antipsychotic drugs in elderly persons, particularly those with dementia, are dangerous. They put the individual at increased risk of negative outcomes, including stroke and death. They're not a treatment for dementia and most often prescribed without informed consent. So as we're watching these data increase, it's not only raising suspicions about the work that had been done as part of the campaign, but it also is telling us that we need to refocus our efforts on providing good and proper care and reducing the use of these drugs in a meaningful way to ensure that residents actually are getting the best care possible, and also ensuring that misdiagnoses is not occurring in residents, particularly those with dementia, that we're focusing on providing good care with the non-pharmacological strategies in order to best meet their needs. Another important right that I want to touch on today is the right to self-determination and to make choices. The ability to make choices and have control over our lives is extremely important to all of us. Many people became frustrated really quickly at the start of the pandemic when all of our routines became interrupted. We were told to stay home. We couldn't go to stores or visit with families or friends, participate in our usual routines. We really value the ability to have control over our lives and to make our own choices. Well, the same is true for nursing home residents. When we talk to former residents that have moved out of the nursing home, one of the things that they routinely say to us is they're so glad not to have to live every minute of every day on someone else's schedule, that they have the freedom and control to decide how they're going to spend their days, what activities to participate in, who to visit, set their own schedules. It's all very important to them, the way it is for all of us. And that's the way it should be in nursing homes as well. Residents' rights language is very strong around this issue. Residents have the right to choose activities, to choose schedules, care and services and providers consistent with the residents' interests, their goals, their assessments, and their plan of care. This means that they have the right to make decisions about aspects of their lives that are important to them, and the right to receive reasonable accommodation of their needs and preferences and to exercise choice the way it makes sense for them. So for example, if a resident likes to sleep until mid-morning, to go outside for a walk in the middle of the afternoon, and then have a cup of tea and visit with friends before dinner, they should be able to do that, whether they live in a nursing home or whether they live in the community. They should not be woken up at the crack of dawn, dressed and sat in a queue in the hallway waiting to be moved into the dining room because that's what's most convenient for the staff. I know that when my routine has been interrupted, I can get cranky. And so certainly would like to ensure that I'm able to make my own choices and set my own routine every day. And certainly residents should be able to do that to the greatest extent possible also. Self-determination and choice also apply to the care and treatments that they receive. They should be informed about the purpose of any treatment and given sufficient information to weigh the risks and benefits of the treatments that are being prescribed for them or being offered to them. And they have the right to refuse treatment if they believe it's not for them. Just refusing a treatment doesn't mean that they don't want any sort of treatment. So just offering one sort of treatment shouldn't be the end of it. We know that there can be multiple different types of responses or treatments to different types of issues that residents may be facing. There could be different choices that could be offered to them. So if a resident says that they don't want treatment A, are there other treatments that can be proposed? Or can you think through and strategize with them about a better way to find a solution, or even get into why it is that they're refusing treatment? Sometimes they just need more information. So a refusal of treatment isn't something that should just be dismissed and saying that the resident doesn't want any treatment at all. It just means that there may be a better solution for them. They have the right to receive care in a manner that works for them. I've talked to several residents who train their caregivers on how they prefer to be cared for. Whenever possible, their preferences should be honored. That's something that one resident I talked to quite a bit talks about often, that whenever a new caregiver is brought into the facility, she takes the time to train that caregiver about how she prefers to be cared for and what makes the most sense for her. And it helps their relationship. It helps the caregiver provide the best care possible to that particular resident. So residents' rights are something that we all recognize are important. Individuals have the right to receive care in the manner that works for them. And the residents are entitled to these rights that I've just discussed and many other rights according to federal law. And while we're not yet at the point where every resident is having all of their rights honored, receiving quality care and experiencing the quality of life to which they are entitled, it does seem like we have been making progress in most places around these issues. But then COVID came. And COVID started spreading across the country. And we know we were all impacted and asked to make sacrifices, and that included residents living in nursing homes. The impact on this population, though, of COVID, as you know, has been devastating. More than 185,000 long-term care facility residents of staff have died from COVID. That is, while the residents make up 1% of the population, the deaths were almost 40% of the people who have died from this disease. Tens of thousands of more residents died from the effects of isolation and neglect when facilities were directed to close their doors and not allow in families or other visitors. The isolation experienced by residents truly was as deadly for many as COVID itself. One of the things that COVID really has shown and highlighted are many of the historical problems that we've seen in nursing homes through the years. Short staffing, poor care and neglect in many cases, rights violations, and a disparate impact on low-income individuals and people of color. Throughout the pandemic, we at the Consumer Voice talked to a lot of residents and family members across the country about their experiences and what was and is happening in their facilities. We've been in regular communication with long-term care ombudsmen about what they've also been seeing and hearing in their states and communities. And we conducted 3 informal surveys over the last year, 2 for family members and 1 for residents, trying to get a better picture of what was happening on the ground. And there's no other way to say it other than to say that the information we've consistently received show that conditions were pretty bad in many nursing homes across the country. We know that short staffing has been at crisis levels in many, many facilities. Routine numbers we were hearing included 1 CNA for 20 or 25 or more residents. Nurses were short-staffed as well. Staff were leaving because of being sick or because they were concerned about their own health and safety or had family obligations. And so that has created a big crisis in many facilities. When families and other caregiver supports were not permitted in the facilities due to visitation lockdowns, that also increased the workload on the fewer staff that were coming in to care for residents. And what we found, and I think what we always knew, is that family members did provide a lot of care and support for residents, but I think COVID really showed just how much care and support families and other caregivers provide to individuals living in long-term care facilities. And it's not just the care that they were providing, but also the emotional supports, the comforting that they were providing for them, helping to calm them down when they were having anxiety or other issues that needed to be addressed. And families were really helpful in ensuring that the residents were receiving the care that they needed. Infection prevention practices and protocols were not always adequately being followed in many facilities, which exacerbated the spread for COVID and increased the lockdowns that were happening. Multiple residents and family members were reporting staff not wearing or properly using masks or other personal protective equipment. They weren't washing their hands before coming into rooms to provide care. A lot of the residents that I personally talked to reported about this. They talked about how they would address the staff coming into their rooms who were not wearing masks properly, not wearing gloves if that was required, or not washing their hands. But many of them, when they spoke up, they either risked not receiving the care that they needed, or some of them faced different forms of retaliation, which is just unacceptable. Residents experienced significant decline, physical, mental, and psychosocial during the pandemic. Severe weight loss was commonly reported, loss of physical ability, such as the ability to walk or transfer from a bed to a chair, but also the loss of cognitive ability was really tremendous during this time frame, and I'm sure many of you saw that as well. We heard reports from family members of their loved ones losing the ability to speak due to not having been engaged or spoken to for a long time, where the symptoms of dementia became exacerbated because of lack of engagement, because of the stress and anxiety, many residents losing the will to live. And reports and even a newspaper article that had come out looking into this issue of the effects of COVID and the effects of isolation on residents did report that at least an additional 40,000 deaths can be attributed to the isolation that occurred as a result of COVID. Residents routinely commented about feeling like prisoners as they were contained to their rooms for months. Many didn't receive proper personal care. Activities were very limited, both in what is and was offered and in how many people could participate in the activities. And both residents and families, as you know, were extremely upset by not being able to see each other. There was a lot of neglect that we've seen over COVID. And while we certainly understand that staffing was short during this time frame, it's not acceptable that we think about the neglect that had occurred during this time, where residents were found to be dirty and unkempt and not having their teeth brushed, for example, or not receiving showers for months, literally months at a time, were some of the reports we had gotten from residents. Not receiving the care and developing contractures and pressure ulcers, and the weight loss that occurred just has been significant. And that's been very troubling in terms of what actually was going on in a number of the facilities. We know that many of the providers and the staff were doing the best they could, that they were providing good care, but in too many cases, the residents were suffering. Many family members and even residents themselves reported insufficient communication by the facility about conditions that were occurring there, about what they were doing to respond to the pandemic. And that only increased frustration. The lack of engagement and communication was really a negative also that came out of this, because as we're going to talk about in just a minute, engaging family members and communicating with them and seeing them as part of the team that's available to provide care, that's available for the operation in the facility, really helps everyone be working in the same direction and towards providing the best quality care possible. There were many places that did a good job of engaging residents and family members, but too often, instead of being willing to share data and information about what was occurring, they just clamped down and tried to hide that information. And that just increased the frustrations of the family members and the residents. So while the impact of COVID has been devastating on long-term care facilities and residents, one of the other things, as I mentioned, that it highlighted was the importance of communication and engagement with the residents and the family members. The presence of family and friends in long-term care facilities and providing the care and supports to residents has an enormous impact on the well-being of residents, both physical and emotional. Not only are they providing a lot of caregiving support, they're the ones who are sitting with residents for 20 or 30 minutes to help them finish a meal when the staff don't have the time to do that. They're there to help with grooming when staff often doesn't have time to do that, or taking them to activities or to the dining hall. They're also there, though, to help with communication and translation of what the resident is expressing. They're often able to identify changes in condition, and they assist with calming residents' anxiety. Oftentimes, because the family members know their loved ones so well, they're able to either anticipate needs, they're able to address them as the resident is trying to communicate. And as we know, when people, particularly those who have cognitive impairment, begin losing the ability to speak or to communicate verbally, they communicate in different ways. They communicate through actions or through behaviors. And being able to interpret what they're trying to communicate is really critical, both for providing good care to them, but frankly also for preventing frustrations, for preventing incidences of abuse and neglect that I think have been occurring because people become frustrated when they're dealing with challenging behaviors. The rights that we talked about earlier, helping a resident achieve their highest practicable well-being, choice, accommodation of needs, involvement in care planning, and other types of rights, they all focus on the provision of individualized person-centered care. That is a hallmark of the Nursing Home Reform Act, of the federal rules, and every resident is entitled to it. Individualized person-centered care means that you learn more about who the resident is as a person. It helps provide greater support for their preferences, and it gives residents increased control and choice in their lives. We do know that by learning about residents' histories, about their backgrounds, about what their likes and their preferences are, it's a better way to provide care for them. And it's a better way to ensure that they are receiving the quality care that they deserve and the quality of life that they deserve. Resident engagement and the provision of individualized care really can help prevent abuse and neglect. While there are many situations, as we know, where perpetrators intentionally and inexplicably abuse residents, there are also situations where the abuse or neglect can be due to other factors, as I mentioned a few minutes ago, like built up anger or frustration, lack of understanding of what a person is trying to communicate, lack of communication, even personal issues that may be happening with a family member or a staff member who may respond or react to a situation, maybe in not the best or most appropriate way. A lot of these incidents can be preventable if we are focused on how to provide individualized person-centered care for the individual, understanding communication techniques, understanding how to provide good care. And ways to do that really include engaging the residents and family members. Knowing the resident and their history, their life story, learning about them, understanding their preferences, their likes and their dislikes. It all helps to promote the provision of person-centered care, and it's helpful in identifying triggers that may lead to distress or clues that may be given for addressing a person's anxiety, for example. So when we think about different situations where residents are trying to communicate, one example could be, for example, that a resident easily gets tired after lunch and likes to lay down for a while. And when he doesn't get the rest that he needs, he'll often show signs of distress, maybe cry out for a long time, become agitated or become distressed in his mannerisms, really be needing a lot of additional attention. But if the resident were given a little bit of extra rest after lunchtime, they find that he's calmer, more conducive to then later on engaging in activities, more responsive to instruction, and more willing to participate with others. So knowing that this resident needs a rest after lunchtime is incorporated into the person's care plan. And not only does it help the resident get what they need, but it also ensures that the staff are not having to spend extra time trying to then translate or understand what it is that the person is needing or trying to communicate. And it also will help prevent trying to just quiet that person. Too often, as we think about the use of antipsychotic drugs that are occurring, oftentimes they're being prescribed when people are exhibiting challenging behaviors or actions that become very frustrating for the staff. And when they're not understanding what a resident is trying to communicate, too often they turn to finding some easy solution, which oftentimes is the prescribing of an antipsychotic drug in order to change that person's behavior, or to stop them from crying, for example, or from wandering, or from lashing out if they're frustrated. But that doesn't get at the root cause of the problem here. Understanding the communication and what the resident is trying to tell you is really what the focus needs to be on. And by engaging residents and families and learning about their backgrounds, their histories, what their cues are, what their triggers are, that is really an important way to provide good care without the use of pharmacological interventions. Another example that we hear a lot is when a resident becomes combative when care is going to be provided in a particular way. So for example, oftentimes we hear it happens when someone is being taken to the shower, where they'll become combative because you have someone who's taking your clothes off and then putting them into a room, and then the water just starts coming down on them from nowhere, and maybe it's the wrong temperature, and the person becomes really distressed and cries out and tries to fight back. If you tried to get wheeled into a room without understanding what was happening to you, you'd fight back also. It's a defense mechanism that kicks in. So when you're thinking about, proper care for individuals and understanding, knowing that Mrs. Smith, for example, needs some additional attention, may not understand that you're just trying to take her for a shower and what the processes are for how to make that happen. Talking through that with her while you're wheeling her down the hall and telling her that we're going for a shower, or as you're taking her clothes off in the shower room and reminding her, Mrs. Smith, we're here to provide a shower for you. Starting the water before she's sitting in and having it just dumped on her right from the very beginning, and letting her test the temperature and understand what it is that you're trying to do. There are different strategies that can be incorporated to help calm her down, to help her to understand what's happening, so that she doesn't feel threatened or that she feels attacked, and will be more willing to be part of, to go along with the caregiving that is taking place right then. It makes her more comfortable, more amenable to the situation. And there are different strategies like that. There are a whole range of information and strategies that can be employed in situations like that. But I guess the bottom line is knowing and understanding the resident, and really would help you understand what their needs are and how to respond to situations when you better understand what it is that they're trying to communicate. Engaging residents and families is important because not only does it help you provide good care for the residents, but it also helps you understand what's going on in the facility. Residents and families know a lot about what's happening in your facility, not only with themselves, but with other residents and family members, with the staff. They're all communicating with each other. And by you engaging with them, you also learn more about what's happening and going on in the facility. They know which staff provide the best care. They know which ones take shortcuts, who's angry with whom, who might be fighting or feuding with another staff person, or which residents like certain staff members to care for them. Staying connected and listening to residents and families really will help you as an administrator, as a surveyor, an ombudsman, or a staff person identify problems that need to be addressed in a facility, and often while they're still in the early stages before they become big problems. You can really take an opportunity by listening and engaging with people to forestall any blow-ups that may occur in a facility by keeping your ear to the ground. It also helps identify problem areas and or concerns, both in the facility and that might be brewing with other residents and with staff. You can really get ahead of issues by staying engaged and talking to folks. The residents and families should be considered partners in caregiving. And as mentioned earlier, the pandemic has really shown us how important the presence of family and friends are to the well-being of residents, both physically and emotionally. They're providing a lot of caregiving support. They help with communication and translation. They help identify changes in condition and provide needed supports. So they're really critical to be thought of as partners, not just as people that have to be tolerated or just thought of as being there as an additional person who you have to deal with. But think about engaging them in the whole process of caregiving, finding solutions and strategies that are going to work for each of the residents, and that will help everybody, again, stay on the same page. So there are a number of ways to engage residents and families. The rights we talked about at the beginning, involving them in the care planning process, getting to know them, their likes and dislikes and their history, figuring out what's working for them. Get to know the families of the residents too, not just the residents themselves. Know who are the family members that are regularly paying visits to their loved ones, paying attention to the changes in the residents' demeanor. Pay attention to the residents' demeanor with certain visitors. Do they react or act one way or another with different visitors that come in? That could also trigger whether there are conflict with any of the family members that come in or friends that come in, where the resident may have different reactions to them or different relationships with them. And by focusing on the reactions and interactions with family members and residents, you can also be attuned to whether there are any potential possibilities for trouble that might brew in the future, and think about how you might address them. Encourage connection with others, including through resident and family councils. Encourage your family members to join or start a family council. Encourage your residents to participate in a resident council, and foster your own communication with those groups, regardless of whether you're an administrator or an ombudsman or a surveyor. Talking to the resident and family groups really does give you a perspective on what is happening in that nursing home and what some of the challenges are that they may be experiencing, and also what they're doing really well. They're happy to share those types of things also. By maintaining good and open communication, not only do you give families and residents the information they need in order to feel safe and secure and understand what's happening in the facility, but you get good feedback as well about what they're seeing and hearing and thinking about the care that's happening in the long-term care facility, what some of the challenges or problems might be. We've heard, particularly through the pandemic, about new and creative ways for engaging and interacting with residents and family members, including regular updates through email or newsletters. A number of facilities were doing Zoom calls with their family councils and family members, and even with their resident councils when they couldn't be meeting together during the pandemic. Ask for feedback on what's happening. Don't be afraid of getting the feedback from families. I think too often we consider and look at it as an us versus them situation. And we need to think of it as a we. We are working collectively to promote and provide good care for individuals. One of the things that has been a real struggle for residents and families is when they do raise concerns with the facility administration or the staff, that they often feel that they're not heard, or that there's no action or solutions that come from raising different challenges or concerns. And that's a real area that I would strongly encourage you to really look at how you're responding to grievances or complaints in facilities. Take a look at what the residents and the families are saying to you about the care that's being provided, about the conditions, or about their life in the facility, and look at what improvements might need to be made or what changes might need to be made. Incorporate them in the solution or strategizing process to develop strategies for making changes. brainstorm with them about different ideas that can be incorporated and talk to them about what they would like to see and do. It doesn't make any sense if you have a really active activities department, for example, that has a million things scheduled every month, and yet nobody wants to participate in them because they're not activities that are of interest. So that's, just a very simple example where you can incorporate residents and families in the decision-making, in the planning processes, so that everyone is getting their needs met, is being engaged in a productive way. And then you have people that are more willing to both want to live and work in the facility. Make sure that people understand their rights and responsibilities. That includes not only staff and administration, but residents and family members. Make sure that they understand what their rights are, that they know how to communicate with you and with others, that they communicate with the staff. And certainly if there are concerns, even as staff people or administrators, that if you have concerns with a resident or a family member, you should be raising those with them right away as well. One example that we hear a lot about are resident bills that are not paid for months and months and months at a time until finally just a discharge notice is sent, and there are thousands or tens of thousands of dollars in back expenses that are owed. If there are issues with that, you need to address them immediately, both with the resident and the family members, so that action can be taken to address the issue that is occurring and solutions can be identified. Residents and families can be really useful and engaged in facility operations, the hiring and training of staff, for example, being part of a quality assurance committee. We hear a lot about residents being part of food committees or activities committees, and that's absolutely an appropriate role for them. But they can also really be helpful in other areas. We've heard of situations where residents sit on hiring teams when new staff are being hired for the facility. Residents are part of those teams. Being part of the Quality Assurance Committee makes a lot of sense because residents and families can have a whole host of skills and resources that can be tapped into and helpful in brainstorming solutions to challenging situations or problems that exist in the facility. And certainly, it would be important to coordinate with your long-term care ombudsman program. Ombudsmen, as you all know, are advocates for residents. They take direction from the resident. And the goal when they're working is to identify a solution to a challenge or concern that's been raised to them to the resident's satisfaction to the greatest extent possible. That may be different from what the staff thinks should happen in a particular situation, or even what a family member should think happens in a particular situation. But the ombudsman will work with the resident to see what it is that they want, what solution or outcome would work best for the individual resident. And that's what they'll be working towards. Ombudsmen often help solve problems before they blow up into bigger problems. And so engaging your ombudsman, staying connected, communicating with them is really important for ensuring that you're providing the best quality care possible and that residents' rights are being protected and respected in a facility. Often they're really great sources of information and resources. Ombudsmen have access to a lot of different resources around the country, including through our organization at the Consumer Voice and through our Ombudsman Resource Center. And they're willing and happy to share that with others. In addition to not only ombudsman and rights-specific information, we share with them a whole range of resources, including around caregiving practices, experts in the field, and other resources that they're usually willing and able to share with others that they're connecting with. While ombudsmen do much of their work visiting residents and family members in the facilities, during COVID, obviously that needed to change because they also were not going in to the long-term care facilities. So they became very creative in the way they interacted with staff, with residents, and with family members. Many work to stay connected through phone calls and video conferences with residents and staff. I would talk to a number of ombudsmen who said that they would be calling the facilities on either FaceTime or through a video chat and asking a staff person to walk through the facility and let them put eyes on the different residents and engage with the residents that way. Many of them engaged with Zoom calls and through phone calls with the staff as well. a number started holding virtual family councils, either with specific facilities or on a broader scale. And Pennsylvania actually was a leader in this respect in bringing family members together from around the state to share information, talk about different issues, and help resolve problems. They regularly engage in a virtual family council meeting. It's grown tremendously, and they're still doing it in a fantastic way. And they've held some really great programs through their virtual family council program through the Pennsylvania Ombudsman program. As soon as ombudsmen could get back into facilities, they were there. They were there connecting with residents. Many of them did window visits, as many family members were doing as well. They were doing outdoor visits on patios when the outdoor visits were able to occur. And now that they're, in most cases, able to go back in and visit individually with residents, they're there as well, providing support and advocacy services to them. Ombudsmen not only advocate for individual residents and groups, but they also raise issues that residents face with other partners and stakeholders, like many of you that are here today at this program. They're a terrific resource and do a great job of raising the voice and perspective of residents. And if you don't know the ombudsman in your area, then I would highly encourage you to engage with them and make it a point to regularly meet with them. Because concerns about neglect and abuse have been paramount during COVID, we're really encouraging people to pay attention to what's happening in facilities on maybe a heightened scale right now, particularly if you're newly going back into the facility after a long period where the facility was closed down or there were quarantines happening there, or if they're having some specific issues or problems. And we're really recommending to those going back into the facility to pay attention to different areas that they need to look at when going back in. So for example, look at the appearance and the demeanor of the residents when you go back in. Are they clean and well-groomed? Are they dressed appropriately for the day? Look at their hair and their nails. Look at their, when they smile at you, look at their teeth. Those are things, are the residents actually being cared for and having proper hygiene? Watch for changes in resident abilities. If you've seen residents, again, that have had different abilities, like the ability to walk or have been very alert, for example, or high energy, and suddenly they're really changed. They're no longer able to walk. They seem depressed. Their energy levels are really low. That's a trigger that something's wrong with that person, and we need to figure out what it is that's wrong with that person. Do residents have their supportive devices, their hearing aids, their eyeglasses, and their dentures? Not only are they important for helping residents to communicate with staff and with family members, but they're also important components of ensuring that they're receiving proper care. So are they also, the dentures really help their ability to eat. The hearing aids and eyeglasses really help with their ability also to ensure that they're receiving proper care and able to communicate and understand instructions that might be given to them. Do you see any evidence of pain or discomfort in the residents when you're walking down the hall, grimacing on their faces, or are they moaning? That's not something just to pass by. Like, what is going on with that person that is causing them to respond that way, and do they need some assistance? When you go in, also pay attention to the staff. Are they wearing face masks or other PPE that's required at that time? And are they washing their hands or using hand sanitizer? I will say that almost every resident I spoke to individually during the pandemic talked to me about how staff were not properly wearing their face masks or PPE. They were not properly washing their hands or using hand sanitizer when they would come into the residence room. Almost every single resident I talked to, and I talked to a lot of them during the pandemic. So that is something that we all really need to pay attention to. This is a very deadly disease, as we all know, and we all need to be doing our part to ensure that, that we're stemming the spread as much as possible. Look at, is there sufficient staff on hand? Facilities are required to post information about the numbers of nurses and CNAs that are working by shift. Considering that short staffing is such a problem by now, talk to your nursing home about what their emergency staffing plan is. they're all required to have them, and look at, are there strategies and ways to help assist them in recruiting or retaining staff, and what resources might be available to them. That is really a critical component, and we know that staffing is the key to providing good care and services to residents in long-term care facilities. And then look at the building. Are the rooms clean? Is there easy access to hand sanitizer and soap for staff, residents, and visitors? And are there activities that you see residents engaged in? Those are really critical pieces as well to get a flavor of what is happening in that facility. I think, as we think about engaging residents and families looking to prevent abuse and neglect, we need to be looking not only what we did pre-COVID or during COVID, but we need to combine all of that as we look forward. Moving forward, we're going to be having some changes probably in practices as we move forward, and how we are ensuring that we're having heightened attention to infection control practices, ensuring that people are receiving care and services that they need. And by focusing in on what's happening, not only now, but in the future in facilities, ensuring that we're doing the best we can to provide individualized care, person-centered care for individuals, we can ensure that the residents are receiving the care and services they deserve, and that their residents and families are full active partners in the caregiving process with the staff and with the administration. With that, I will close for today. Thanks so much for having me. If you have any questions, I'm happy to answer them. Certainly feel free to contact me at any point. My email address is lsmetanka@theconsumervoice.org, and you can get more information about our resources at our website at www.theconsumervoice.org. Thank you so much.
Thank you, Lori, so much. That was great and very interesting. I did put in the chat section a link to Pennsylvania Department on Aging's Ombudsman program, as well as our Bucks County program. I do know that there are some folks from our other area agencies on aging who are attending. So if they want to put into the chat as well, direct phone numbers for their county ombudsman program, that would be great. I did want to mention that one of the things, Lori, that I'd love to talk to you about at some point offline is that, and to let people know, is that we have developed in Bucks County something that we're concerned about, the fact that seniors are such a vulnerable population for abuse, especially those in facilities who cannot communicate very well, et cetera. So we have developed what we call our Special Victims Initiative to provide a coordinated multidisciplinary team approach to investigations of allegations of abuse with trained forensic investigators who can work with the families and the individual to help them to explain what happened to them and to help the investigation. And, it's just something that I feel, and a lot of folks feel very strongly about, that we need to be doing more to assist those individuals. So it would be great at some point to talk to you more about that. But thank you. We really appreciate the use of how we, in quotes, we are working together, and we need to work with families and individuals. So thank you so much for your message and for the information. And we did put on chat as well. Lori put up her contact information.
Thank you so much.
Thank you. So we are coming up to our break time. We are right on schedule. We will be having a break from 10:30 to 10:45. Again, during that time, you're encouraged to visit the sponsors' videos. Just a reminder, your next breakouts, the breakouts for the rest of the day, you won't see me until the end of the day. I know that's very disappointing, but you won't see me again until the end of the day. And so during the rest of the day, you will just go on the Blue Jeans links for the various workshops that you wish to attend. And if you have any difficulties, you can email or contact us to let us know. Okay, thank you so much. Enjoy the rest of the day, and I look forward to seeing you at 4 o'clock. Take care.